Well, it's no longer a question of how young is too young, but now we're asking for the sake of our kids' health.
Yeah, after the break, the medical risks and effects of the morning after pill, now that it's offered, or it's soon going to be offered, to kids as young as 15. It is 8:15, Gina, thank you very much. On Tuesday, the Federal Drug Administration made the decision to make the morning after pill available to girls as young as 15. It will be over the counter. All a girl has to do is show ID. There's no requirement to have a parent involved. And this morning, Dr. Angela DeRosa is here to explain the medical risks and effects of the pill. But first, before we get to that, we want to share some reaction from parents. Listen.
I'm really uncomfortable with that. That's children under the age of 18 making life decisions, and that really needs to be discussed with a parent.
I think that it's better because then the kids who are younger aren't scared to go and get it, because there probably might be kids who are scared to go to their parents to ask them for help.
I feel like I would really need to review the facts around the numbers of young people that are using this pill, what the prescription rates are right now.
Well, there's certainly some mixed reaction to the news. We want to know how you are reacting to this, and we'll get to that part in just a moment. We want to be interactive about this on our website. But Dr. DeRosa, how are you reacting to it?
I guess I have mixed feelings about it, one as a woman and one as a physician. Because as a woman, I think it's nice to have choices to be able to manage our own health care and our own bodies. But as a physician, I'm a little bit concerned that we're putting a fairly large decision in a young person's hand. These are not fully matured adults. And I mean, we need to have a doctor's appointment to get antibiotics. And now we're talking about giving women hormones at high levels to prevent a pregnancy, which we don't really fully understand the long-term consequences of doing that on a, say, regular basis. And you're also taking me out of the loop of that relationship with that patient to discuss those implications in the long-term care.
Let's talk about the implications. How does the pill work? I mean, what does it do?
Well, the Plan B is a one-time pill of a progestin, which is levonorgestrel, and what it does is it prevents either ovulation or it prevents the fertilization of the egg with the sperm, and there's some degree of skepticism, does it actually prevent implantation as well? So most often it's just delaying the ovulation and that fertilization, but the big controversy comes upon that implantation piece, because are you actually, quote unquote, aborting something that's already been conceived, or are you preventing implantation, or are you truly just preventing the fertilization of the egg? I think there's a lot of data that needs to be explored there.
What are the long-term health risks here? I mean, could there be fertility issues down the road?
I don't think anybody knows the true impact of that. Certainly if you're taking the morning after pill, say once or twice in your lifetime after an oops, I don't think there's going to be any major consequences of that. But if you're now establishing that as your routine birth control, who knows what that could be? If you're taking that on a monthly basis, you're altering your periods of your body, your biochemistry, how the brain is functioning. I don't think any of us really know what that long-term effect is on a regular use instead of what it's intended to be.
Then it probably wouldn't even be fair to ask you how often it can be safely taken.
Again, that's a question I don't think people know. How safe can we? Should you be taking it monthly? Absolutely. I think that's not safe for any woman. If it's, say, periodically, maybe once every few years, I don't think you're going to get in trouble. But if you're using it as a birth control method, that's a problem.
All right. Well, we did mention this. We want to know what you think. We're taking a poll on our website, azfamily.com. Just scroll down and click on Health News. Dr. DeRosa, thank you so much. We have some